the first conversation today would be the issue of PEPFAR suspension of $390 million. That's what is at stake and what Nigeria faces to lose annually. Talking about the PEPFAR, that is the President's emergency plan for AIDS relief, an initiative of the United States to vulnerable countries to help combat the HIV/AIDS scourge the world over. With the funding now halted due to an executive order by U.S. President Donald Trump, Nigeria's federal government is now faced with a tough dilemma it never planned for. Now, there are a few issues to consider as regards how this will be troubling for Nigeria, especially the Niger Delta region. We do not know if that has changed recently, but last updated statistics provided by the National HIV/AIDS Indicator and Impact Survey NAIIS pegs Nigeria's Akwa Ibom as leading the pack with about 5.5% prevalence rate of HIV/AIDS, while the South-South region leads other regions of the country by 3.1%. Well, would be a report by NACA also shows that Nigeria provides less than 20% of its HIV/AIDS funds, despite having nearly 2 million of its population living with the condition. But what will happen now with this executive order by President Trump? Will Nigeria brace up to the funding challenges? What are the real risks confronting the Niger Delta region? We'll be seeking these answers together with the Chairman, Association of Community Pharmacists of Nigeria Akwa Ibom Branch, Pharmacist Anderson Tony. He joins us live on the program. Pharmacist Tony, you're welcome on Niger Delta Today. It's good to have you.
Thank you for having me. It's a pleasure. Good afternoon, viewers.
You're welcome, sir.
Thank you.
Yes, Pharmacist Tony, this news about the PEPFAR suspension, an executive order put out by President Donald Trump, came unexpectedly. I mean, Nigeria wasn't prepared for this, and according to what we know, over about $390 million is what Nigeria stands to lose annually if this executive order stands. Let's look at it holistically, especially as regards the risks Nigeria stands, considering the prevalence of HIV/AIDS in the country.
Okay, well, the suspension may look abrupt to us, but it was something that was expected because the funding, the PEPFAR funding started in 2003 by President George Bush. And the initiation was to strengthen the capacity of developing countries, give them technical know-how, and give them funding on how to manage HIV cases. And about 2004, thereabout, Nigeria was enrolled and enlisted, and then we started this program. But then it must be noted that this program by PEPFAR is done by the U.S. tax earners' money, not by the Nigerian tax. We don't pay tax, we don't contribute to the money that comes. And so if somebody is taking care of you or have initiated a thing to take care of you without any obvious benefit, just to help the system, and humanitarian thing, you should know that such help cannot be said to be permanent or is going to be a long-standing thing. And when you look at the PEPFAR program, it's something they renew and do yearly. Every year they come up with a budget and they run out the program based on the statistics they have. And so the Nigerian government and most people, for instance, I have always said it about 15 years ago, I've always asked the question, what happened? Because this program has been here for 22 years now. If you look at 2003 till 2025, about 22 years. And so even if Donald Trump reverses this executive order and it comes to stay, the big question is it possible to have this for life? Is it possible for them to continue funding us? Now, what the American government just did is only to withhold their fund, $390 million. They are not taking away the facilities. They are not taking away the trained resource person. The people, I've worked closely with most of them. I've not seen any white skin there. All of them are all blacks. Okay. What it means that in Nigeria we have everything we need. The only thing that I've withdrawn is the funding. What that simply means is that if we have that funding, even if not up to that amount, then we are going to have a sure continuity. So the truth about the matter is that, yes, PEPFAR has been doing a very good work. They have been able to strengthen capacity. They have been able to train so many persons. They have reduced viral load. We are almost about achieving the 95%, which is 95% testing. out of that 95% being on drugs and 95% having a very low viral load. That was the aim. That is still achievable because apart from the funds that have taken out, they've taken out nothing else. The structures are there, the individuals are there, the capacity is there, and all of that. What it needs is for the Nigerian government to be very deliberate and intentional about helping people live. Of course, it's not only HIV services they were rendering services. They are family health, but I think HIV service is more pronounced because of its, so much impact it's going to have. The impact it's going to have in the society. But they were doing just much more than the HIV. And so what we need to do, because for the HIV patient, is really not easy with them. Having that burden of taking medication daily throughout your life, it's not even only the medication they take. They also need to do some assessment, check their viral load, their CD4 count. A lot of other testing aside the drug goes on, and all of them cost money. And so let's look at a scenario where the US withdraw and the federal government is unable to fill in that vacuum properly. Then it will affect mostly the patient. And the implication is that we may start having variant strain of the HIV mutating, because as it's here now, we're having a very low viral load. Most of the persons that are living with HIV are taking their drugs, and their viral load has been so suppressed that transmission becomes almost very minimal.
Touch that, even when they go for a test, it's almost invisible.
Yeah, sometimes it could be negative. That has been possible because there have been this availability of the drugs. And when you look at the resource person working with these NGOs that are right now at home, I've never heard them, for the number of years PEPFAR have run go on strike, I've never heard them have any discontinuation of service. It has been smoothly because the people funding them were very deliberate. They make sure everything was provided. But within this period, you'll be hearing Nigerian government medical health teams go on strike severally. So these kind of programs are programs that, if we must succeed, all we need to do is hold on to the structure that was there and even improve better, so that we shouldn't pick it the way PEPFAR left it and it started going down. It should even go up, and that would take a lot of goodwill and good intentions towards the program.
Okay, sir, you mentioned about 95% compliance when it comes to testing and those on their retroviral drugs and all of that. Is that not a good place for us to take over? Because if you get 95%, so to the US government, you're doing fine, and it could be seen that you can stand on your own.
Initially we were targeting 90-90. That is 90%, 90%. Okay. But the new plan, because like this PEPFAR, what has been behind their success, and most of even the advanced country, is proper planning. They normally have long-term plannings. They can tell you what will happen in the next 5, 10, 15 years, and they are very realistic. So the plan between now to 2030 was to achieve 95, 95, 95. And this achievement is not just verbal or imaginary. You have data to back it up. They will show you that this place is 95 now. Like the statistics for last year, they were trying to get to 90 before now. They show statistics that was almost 90, or some even went a little bit above it. Now they wanted to scale up to 95, and then maybe the next plan would have been to scale up to 100. And that would have brought us perhaps to the end of this HIV scourge. I'm saying that we were planning to get to this 95, 95, 95 before this occurred. As I speak to you, most of the major stakeholders in this field are all at home as of today. There's this circulation by the U.S. Secretary about waivers. Yes, they have started saying something, but before they went home, there was a clear official mail to all of them telling them stop work, and that is why they are at home. Now, with all of the speculations in the air, there is no official document telling them resume work. It's like you're working here and you've been asked to stay home, and you are hearing that they say the work will start. All those ones are mere speculation. There is no official document instructing them as at this moment to return to work.
All right, Pharmacist Tony, well, it beats our imagination to see that Nigeria contributed a very insignificant percentage. I hear about 20% of whatever the intervention efforts have been to ensure that this virus is kept very low up till this moment. Now, let's look at the commitment that you see the Nigerian government would be able to invest currently to see to it that we continue to keep this under control. Do you see any leaves of hope? And especially when you look at the implications this would have on patients who don't even have enough to eat, and they start bothering about having to pay for these drugs if it has to get to that. How heavy would that implication be?
Well, what I can say, my personal opinion, is that Nigeria have the resources. That's true. They have the resources, because when you look at wastages in government like this, at some point you hear that so person took billions that they can't even read on calculator and on the system.
Okay.
When you look at the loopholes and the heavy money that goes down the drain, if all of those money is converted, we can do so much. And so for me, looking at Nigeria, is not the finance that is the problem as much as the intention and the discipline to implement it. Because when PEPFAR was running this, everything goes out smoothly. In the morning, there are vehicles to take those going out on field work. Because when you look at this topic, it doesn't even affect only those people that work directly with them. You have doctors, pharmacists, nurses, and community health workers, numbering over 20,000 that were on their payroll. All of them are at home now. The number of people affected may even be more than that 20,000, because they had a lot of ad hoc staff. They had a lot of chains of services, car services, hotel services, because they were always doing a lot of training. So a lot of persons that were closely dependent on them, on existence, are going to have the hardest time within those 3 months, because it means no income. Even those people that are at home now, even if they are to resume after 90 days, they are not going to pay them salary, because they were not on strike.
Yes.
They were not working. There is no hope for them. And so that's the economic implication that is very obvious. The major question you ask, Nigeria has the resources. What I don't know is that if they have that willingness and the discipline to do it. Because this morning I was listening to news somewhere, and I heard the former NHIA secretary, how much he looted, and EFCC took him to court and is in a prison now. So you find out that most times the money is there, but it's always misappropriated.
Meaning, even when PEPFAR was actually funding, it's possible there was no complete exhaustion of what they were giving to Nigeria.
No, I'm not saying that. The NHI is different.
No, I'm trying to relate it to
yes,
that.
I wouldn't know, but what is very important, which you know and I know, is that the Nigerian government and the individuals, they are really not sincere.
Okay.
I'll give you an instance. During the malaria thing, when they were giving malaria drugs free, Quarten. Nigerian government is giving Quarten free. You hardly will see them in the hospital. Well, go to the open market, you see them available. How does it get to the open market? Now, why this service by PEPFAR was this way is because of their strong structure, where everything is documented. They look at data, every report, you send it to USAID, everything you do, you must forward it, and they pay you promptly. You will not see those HIV drugs that, were being used in the open market. It doesn't get to hands that it shouldn't be, because they had well-controlled structure. The difference why they have been here for this long, and then things were going right the way it was, it was that you can't beat their structure, because their implication, don't forget, they earn very well. They were paying them very well. Another thing is, if the federal government picks up this responsibility,
can they pay the workers?
Can they pay? As of December, they increased their salary by 30%. While others were shouting minimum wage, those guys' money, whether you're a driver they earn over 100 or something thousand, which I'm aware, but aside the allowances they get. Will Nigeria be able to sustain those salary structure? I doubt if they can.
Okay, but
I doubt if they can.
The rumors you were talking about resumption after 3 months, is it possible that this has to do with maybe the transparency level when it comes to this?
Well,
and there might be a reallocation of some of these funds and a reduction, but continuity is
if they must continue, one thing is that they are going to do a review of the budget.
Okay.
Because what, in my opinion, what pains these people sometimes is the kind of loot that goes on in these countries. You find out that their leaders are looting and they're evidence-based. They will mention that Mr. A have taken, they discovered in a pit, in a room, so billions of naira. These people are getting this information.
True.
And so their question is, how come we are even
making all
using
these
our small
sacrifices
money
and then
to pay?
Our taxpayers'
And they say
money.
they don't have money, their own taxpayers' money, they are looting it. And so until the Nigerian government change and put the right people there to do this work, if they take over, I doubt. If they get it right, it means there's going to be a real change in attitude.
Okay.
It means there's going to be sincere persons being handled there. Because, for instance, we, the community pharmacists, we are involved in these HIV services. We were all accredited. And so they come in to pick these drugs from us. None of those drugs have ever been, has ever been said to be missing. Because they have a system.
True.
If they give you a number, you account all to them. And so for the number of years we've been involved in HIV services, you cannot even think of. But when it is government, I doubt.
Okay, so
there must be a real change.
So while we're hopeful for continuity, we should do our internal investigation and uprightness. We should set up a solid structure.
If the government can do the right thing, because they know the right thing to do. It's just 1 or 2, 3 individuals that will connive. And a huge chunk of money will be, either snake will swallow it or something. It's in Nigeria you hear those kind of
so while
things.
working with them, you said you work with them.
Yeah.
If the government was to take this over, because now you're talking about deliberate intentions,
Yes.
and the government is saying, we cannot pay you what PEPFAR has been paying you, but we want you to continue in the light you have been working.
I know,
We're going to give you like 50%. Would you continue?
But for the community pharmacies, what we were doing was voluntary. What we were doing was, helping the society. So our services, we were not paid, but we dispense those drugs.
But do you think those working with them would want to do what?
No, they
explained?
won't. They won't.
Those
ones that had a salary structure,
yes,
will want their salary structure to be maintained.
for patriotism's sake.
Yeah, well, but how would they work free? Like
not free, like maybe a slash, like 50%.
Oh no, if they slash, what will happen is that some of them will leave.
Okay.
Indeed.
Because some of them stayed back because of the huge amount.
Yeah,
and they may not be as committed as they were anymore.
Well, Pharmacist Tony, what really stands out is the fact that it is possible that things can actually work within this climb. I mean, if we see what PEPFAR has been able to do in the past year since 2004, it really shows that with the right structures in place, things can actually work.
The structures are there. The structures are right. The PEPFAR structure, they've not taken any of them away. They are all here with us.
That is the point I'm
and in
making.
all those African countries.
And I'm juxtaposing that with what's happening in Nigeria. It means that if we actually put the right people in places of leadership, they can actually
if we have
work
the
well.
right monitoring sequence, because, for instance, all the activities here was being monitored closely with them.
Okay.
So what the government needs to do is bring the funding, have an independent analytical monitoring group that will look like the PEPFAR themselves.
Okay.
Let them have where they report to, and then the people. So if there's a kind of checks and balances, then they will be able to checkmate any abnormality.
All right.
that
Wouldn't
may
there be
want
an
to
extra
arise.
cost?
It will be if you get something right with an extra cost, what does it matter?
Pharmacist Tony,
Yes.
we really need to round up. But then, let me just put out a question on the prevalence currently of this virus, especially here in the Niger Delta region. I understand that the last statistics has it pegged it at 5.5%
Yes.
for Akwa Ibom. Has that changed?
No,
And the South through 3.1%.
Well, it may not change significantly yet, but with the program and with the plan they had, we were supposed to see real changes. We were supposed to see the data and statistics drop. And so now, in all my conversation, I've mentioned so much of the government. They have a role to play. But individuals now have to go back to the ABC of HIV, which is where A stands for abstinence, B stands for be faithful, and C stand for to make use of condom where necessary. While we are looking at the government to do their part, we have this ABC part to play, because now there are a lot of uncertainty. We don't know what happened else. So why we have the burden of those that has already been affected, it's my desire we shouldn't have more people get affected. That's why I'm telling the public, let's go back to the ABC of HIV.
Pharmacist Anderson Tony, Chairman, Association of Community Pharmacists of Nigeria, Akwa Ibom Branch. Many thanks for joining us at Niger Delta today.
Thank you for having me.
Thank you so much for being with us.
Thank you for having me.